It's time to ask the medical expert. We're welcoming back Dr. Brandon Kleemann with ChiroPro.
Welcome back.
It's been exciting to do this with you guys.
Yes, we've talked about so many things. Neuropathy, red light therapy, chiropractic care.
Yes, ma'am.
Now decompression therapy.
Decompression therapy. So decompression therapy is a modality that we use. It's very gentle. It's a non-surgical, very non-invasive modality that we'll use. What its goal is to take pressure off of the joint for spinal compression. It can help with sciatic issues, arthritic issues. The list goes on and on with these types of things. It can help with migraines, headaches, things like this as well.
And it's non-surgical.
Non-surgical, very easy, very gentle. Most people will find it very relaxing. I've even had to wake a few people up a few times. Yeah, they really do enjoy it. It's really nice.
This isn't hanging from the ankles, is it?
It's not hanging from the ankles. However, I will say that that's the inversion table. I think that's kind of what we refer it to. There are different brands. But the inversion table is a little different. So the decompression table is very specific. It's a computer-controlled system, so we can set the parameters up to suit you, Brittany, or you, Tim, to do exactly what your needs are. I can change it however I see fit, and I can make it work for your symptoms. It's very, very patient-specific. The inversion table is a little different. The inversion table, you strap yourself in at the ankles, right? And then you generally tilt yourself at, I think, something like 60 or 90 degrees. The idea with this is, as your gravity is kind of pulling you down, and most of it's still going to the table, but the idea is to pull the joint apart, or to decompress, if you will. So what's happening when you strap yourself to the ankle and then you go upside down is that most of your decompression is going to happen at the heaviest joint, which is your ankle, then your knee, then your hip. By the time it gets to your low back, your mid back, and your neck, you're getting a fraction of generally what you would do.
Oh, wow.
So that's the main differences between the decompression table.
So the table actually targets it.
Targets you. Targets the area. You can do the neck, you can do the low back, and it'll get certain specific areas. And again, if we can change it how we see fit for the patient.
What parts of the body is it most used for that people come in to? Maybe the back or something?
Yeah, so the back. So decompression, if I were to simply define what it is, it's literally just taking a joint and creating negative pressure within that joint. Well, the body doesn't generally know what to do with negative pressure, so what's it do? It fills it with fluid, and that's the idea, is to hydrate the joint. So we can do that anywhere in the cervical spine. We can do that anywhere in the lumbar spine. So your neck and your low back. We can actually even get a little bit of decompression in the mid back as well. We've got a device for the knee as well. We can do quite a few different things. For the chiropractors, we can actually do a little bit of decompression manually. So with the adjustment, we can do with certain joints that are a little harder to do on the table. We can always do, with our hands. So.
Wow. Will a scoliosis cause a problem for that, or?
No, actually, it wouldn't cause a problem for it. So what would happen is with the scoliosis, if you can imagine an entire spine, a bunch of bones stacked up on top of each other, the joints in between, when they wear down unevenly, they start to bend and bow a little bit. So the idea is if I can get more joint space in there, creating negative pressure, pulling fluid in, that joint space will start to even out a little bit. So you actually it may not always correct the curve, but it'll allow the joints in the curve to become more mobile. And that's what we want more than anything, more mobility. Freedom to move around and be pain-free, hang out with our kids and our grandkids without, being hurt on the floor from it. So.
No doubt.
Yeah.
No doubt.
What do you have to say for people who are afraid and think it's painful?
Oh, it happens a lot. There are a lot of patients that'll say, I don't know, it looks painful. And I'll say, come over here, someone's on it right now. And they'll see it, and they'll see someone's just kind of resting on it. They're like, oh, yeah, no, that's not painful. But I do kind of explain it in a way where it does make a sense. So like I said, most people find it very gentle, very relaxing. I tell everybody, kick back, relax, play on your phone, read a book, take a nap. So they generally get one session of it, and they go, oh, yeah, this is actually really nice. So.
And this is great for people who may have tried everything else, and they think, I've just got to live with it.
Yep.
No, if you haven't tried this yet, give it a try.
Yeah, absolutely, give it a try. It's a game changer. It's a game changer for arthritis, sciatic pains, headaches, migraines, tingling, burning in the hands, things like that. We'll do a simple $37 consultation. We'll take X-rays. We'll do exams. We'll find out exactly what's going on, and then that's when we'll determine if the table or the knee compression would be right for you as well.
Yeah.
Yeah.
And if the decompression therapy doesn't work, you are a one-stop shop for trying to figure out what other alternatives that can help.
That's why we do it. There's a lot of people that will kind of stop at their scope. That's why we introduce different therapies and modalities into the office, so we can move to the next thing, or at the very least apply it. So for example, we have something called the knee decompression. So people with meniscus issues, instability issues, surgeries, we'll also apply like ultrasound to it. Have you ever had therapeutic ultrasound or the therapeutic ultrasound would be, we would apply that to it to make sure we're getting you to your goals.
There you go.
Yeah.
Decompression therapy, give it a try. It is Chiro Pro is the place.
Yes, sir.
Illinois locations in Shiloh, Highland, Troy, and Columbia. Missouri, and St. Charles. Keep it here. We got more coming your way. Studio STL.